let's talk about the fear of loss and sharing your pregnancy news. In this lesson, we're going to talk about emotions, negative emotions, and mixed emotions in early pregnancy. We're going to talk about all of the work that you will be doing as you move through your early pregnancy in your Sterling Parenting Toolkit. We're going to talk about the numbers for pregnancy loss and the percentages. I'm going to share my early pregnancy mantra with you, and then we're going to talk about some of the considerations for sharing your pregnancy news, when and who with, and then finally we'll talk a little bit about home Dopplers. Moving with and through the fear of loss and making decisions about when and who to share your pregnancy news with are very helpful in strengthening your parenting toolkit. And so as we go through this lesson, I'm going to highlight some of the ways you are strengthening your parenting toolkit when you move through this part of your journey. So fears and worries in pregnancy are expected and okay. It makes sense that you may have some fear or some worry. This is something that you care a lot about. And anytime you care a lot about something, fear and worries are going to pop up. And that's okay. It's not necessarily a bad thing to have some fears and some worries. We'll talk about what to do when it gets to be too much, but just in and of itself, fear and worries are expected and okay. It's also okay if you don't feel excited all of the time. This idea that the primary emotion that a pregnant person feels for their entire 10 months is excitement is not congruent with reality. That is not how people experience pregnancy. You can feel excitement, but the idea that you're going to feel excitement for 10 months straight is just, frankly, ridiculous. But as you move through your pregnancy, you'll hear from a lot of people, oh, aren't you just so excited? Oh, you must be so excited. And when people keep telling us how we should feel, it's very easy to think, oh gosh, why am I not feeling that way? I'm not feeling that way. There must be something wrong with me. And we don't always question the idea that we should be feeling that way. So we're going to work on that. Don't worry. So it's very, very common, and I've talked about this already. It's very common for people to feel a mix of emotions in pregnancy and in early pregnancy, especially if you've experienced a loss before. Now, if you are feeling some of the quote unquote negative emotions, if you're feeling fear, worry, disappointment, regret, any of the negative emotions, frustration, and you share that with someone, because when we're not feeling blissful and happy in pregnancy, sometimes we want to share that with another person so that we can feel seen and we can feel reassured and supported. Sometimes when you share some of these negative emotions with other people when you're pregnant, you will quickly see that some people are uncomfortable with that. And they show their discomfort by trying to find a silver lining for you right away. So, well, at least you can get pregnant. Aren't you just so grateful that you can get pregnant? Don't be worried. You know, they're trying to make everything okay because they're uncomfortable sitting in that emotion. Understand that that can happen, but that doesn't mean that how you are feeling is wrong. Emotions aren't good or bad, okay? They just are. They are pieces of information and data that our body and brain are sending us. And when we look at them as data, when we look at them as information, we can explore them with warm curiosity. We can say, it's interesting that I'm feeling that way. I wonder why. Because these emotions just are. So anger, the emotion, not bad. Acting out of anger and hurting another person, that's bad. That's not a good thing to do. But the problem isn't the anger. The emotion comes to us, and if you understand a little bit about the brain, emotions are in the limbic system, which is a deeper part of our brain that we don't have conscious control of. It's not part of our cortex and our prefrontal cortex specifically, where all of our executive functions are. So the limbic system, the deeper part of our brain, some people think of it like the mammalian brain, that is where our emotions arise from. And then our conscious brain, our cortex, our prefrontal cortex, become aware of this emotion, and then we can take executive action. We have choice in how we handle that emotion, but we don't have choice and agency to control what emotions we feel. Otherwise, we'd all just say, I'm going to feel happy and blissful all the time. That is the emotion that I choose. Unfortunately, our brain doesn't work like that. So emotions are not bad or good, they just are. So when we are feeling a certain way and we share it with another person and they give us the signals that they are uncomfortable with our emotions, I want you to understand that that's their discomfort. It is not a problem with how you feel. That doesn't mean that it's not disappointing when somebody doesn't see us or sit with us in a negative emotion or hold space for us when they're trying to just find a silver lining as quickly as possible, or tell us why we shouldn't feel that way. It's disappointing. There's no getting around that. But let's just acknowledge that that's their discomfort. It's not that what you're feeling is wrong. What you're feeling is okay. All right. So throughout your pregnancy journey, throughout your time here inside Sterling Parents, we're going to be gently moving away from the shoulds. It's not something that happens overnight. And don't worry, this is going to keep coming up throughout your pregnancy journey and afterwards. After you give birth and in that first year postpartum, as we grow and evolve as mothers and as parents, we're going to keep coming back to this. So this is just right now is about just noticing the shoulds, and very gently we're going to move ourselves away from the shoulds. And when we do that, when we notice some of these shoulds and we gently move ourselves away from them, we are really strengthening that deprogram brain skill. And as I've talked about, this is so important because we want to not pass on those shoulds to the next generation. They're hard enough for us to deal with, right? We are having to deprogram ourselves from a lot of these ideas about what we should be and what we should look like because they were passed on to us and shared with us from our society and our culture as children. And now we get to deprogram our brain so that we don't have to pass that on to our kids. It's inevitable that they're going to get these messages from other places, but we can, by doing this ourselves, we can help them as they grow. So let's talk a little bit about pregnancy loss percentages and numbers. So miscarriage, early pregnancy loss is relatively common. It's estimated that about 1 in 4 pregnancies end in loss. Now, when we get to clinically recognized pregnancies, that means you've gone to a healthcare provider and they've diagnosed you as pregnant. We see that about 10 to 15% of clinically recognized pregnancies end in loss. So the difference between that 25%, that 1 in 4, and that 10 to 15% of clinically recognized pregnancies is a lot of those chemical pregnancies, which is essentially very, very early miscarriages. Once you have an ultrasound that has detected cardiac motion, we drop down to less than 10% risk of loss. And then once we move into the second trimester, so that's after 13 weeks and 6 days, the risk of loss drops to 1%. And then as we move through the second trimester, it actually gets to below 1%. So most of the pregnancy losses are occurring in the first trimester, and most of them are occurring early in the first trimester. So let's talk about mantras in early pregnancy and throughout pregnancy. So this is my early pregnancy mantra. I surrender to this journey, whatever it may be. I hold this flicker of life in my heart. I am happy to be its home for as long as I am meant to be. This is a mantra that I said over and over again in all of my pregnancies. And for me, the most important part of it, and it may be different for you, but the most important part of it for me was I'm happy to be, I would say, your home for as long as I am meant to be. So if that mantra resonates with you, please use it and take it, or take it and make it your own, or come up with your own early pregnancy mantra, whatever feels right to you. The idea is that when you are feeling, you are, having worries and anxieties about loss, or you're feeling panicky in your body. So that requires some mindfulness, some awareness of what's going on, the thoughts that are occurring in your brain. And that also requires a little bit of awareness of what's happening in your body. When you are feeling that when you are feeling a little nervous or anxiety in your body, or you find that you're having a lot of those fears and worries about pregnancy loss, you can bring yourself to your mantra or to this mantra and help calm yourself. It doesn't mean that they go away. Oftentimes they do come back, but it's about recognizing in that moment that you need a little bit of calming, a little bit of reassurance. And a mantra can do that, a mantra or a prayer, however, whatever works for you. And when you do that, when you notice that you're having fears and anxieties and, fearful thoughts, and you notice that you're feeling fear in your body, you are flexing your mindfulness skill and you're flexing that mind-body connection skill. Super, super important in pregnancy and in parenting. And so just that act of noticing when you're getting really worried and bringing yourself to a mantra is so powerful. So if you can do that even a few times, this isn't, even if you do it 1 or 2 times, that's really powerful. So if you're finding that you are, the mantra is not helping, and you are still feeling a lot of fear and anxiety about loss and just about things in general, you can't shake that panicky feeling in your body, you may need more help from a licensed mental health care provider. And if you think that you need that help, please talk to your OB provider. You can find someone who can hold that space for you and help you move through this pregnancy. So get that help. If you are feeling like you might need that extra support, don't wait. Get it. You also can use our 12-week mindfulness program. The Sterling Parents Mindfulness Program can really help with a lot of these anxieties and fears. Mindfulness programs, specifically this one, can be used to help support you if you're dealing with anxiety or depression. It can be really, really helpful, and we have good data to support mindfulness in the management of anxiety and depression. So let's talk a little bit about sharing your pregnancy news and things to consider. So the old rule was to wait until you were in your 2nd trimester before you shared your news, your pregnancy news. And the idea was, so you didn't have to share if you had a pregnancy loss. So that's the old rule. The new rule is you share your pregnancy, or don't, whenever you want to. You don't have to ever share it with anybody. And if you want to share it with the world with a positive pregnancy test, you do you. It's up to you. So just some things to consider when you're deciding when and with whom to share the news. Be aware of the shoulds, okay? Shoulds can show up with the idea, well, I should tell this person first, or, next. I should tell my mom before I tell my best friend. That's how the shoulds can show up. Sometimes there are people who are really close to us, who have those relationships that are very close, but they're not necessarily the right type. They don't offer the right type of support for us. And so maybe when you are in your early pregnancy, you have the thought, well, I should be sharing this news with my aunt because, she's around all the time and she's my aunt. But the support that she provides me actually doesn't really feel very good. And so we move ourselves away from the should, and we move to whose support do you need? Who has earned the right to show up for us in a vulnerable time? So when you're deciding who and when to share the news with, you can ask yourself, whose support do I need? Who do I want to tell? And understand that, yes, if you share early news of a pregnancy early, you may also have to share the news of a pregnancy loss with someone. But a lot of times that's what we need. We need other people to help support us when we're going through something difficult. but this is all about what's right for you. And it's also about boundary work a lot of the time. So when we decide who and when to share our news, we are working on our boundary skills. Boundaries are hard. They just are. If you have done boundary work before, then this may be something that is part of who you are now, and it's not such a struggle because practice helps. The more you work on boundaries, the more you set boundaries, the easier it becomes. But a lot of times we don't even get started because the fear of setting the boundary. The thing is that as we become parents, us protecting our boundaries is protecting our children. We protect our children with our boundaries because they are not able to set boundaries themselves, okay? We teach them how to set boundaries, and we have to set boundaries for them. A newborn can't set boundaries with family members who, are sick or who are, not vaccinated. We have to set that boundary. And so boundaries come up a lot in the postpartum period. When deciding who to be in your labor room, with our children as they move through their childhood, boundaries come up a lot. So starting this to work on boundaries with intention from the beginning is really powerful work that you're doing. So whether or not you do a good job of setting boundaries at this stage doesn't matter. Just being aware that deciding who and when to share your pregnancy news with is boundary work, that's enough. That's enough right now. It is okay for people to be mad and upset with us. That's okay. Your job is to set the boundaries that protect you and your family. Okay. So this is really helpful for me when I have to set a difficult boundary with somebody that I care about. The way that I see it is that I would rather honor my boundaries and have you be upset with me than to betray myself. And when I don't set a boundary that I know that I need, it's a small betrayal of me. We're not talking huge betrayal. Most of the time it's a small betrayal. And I don't want to betray myself in these small ways as I move through my life. I want to honor my boundaries. So that perspective is really helpful for me. If it's helpful for you, take it and use it. If it's not, move on. All right. So when we do this, when we listen to our boundaries and we protect ourselves with those boundaries, we are flexing a lot of our skills. So we're flexing obviously the boundary skill, but it's also protecting our well-being proactively. That's self-care. Intuition, it's listening to ourselves. It's listening, I need to set this boundary. This is important to me. It's about intuition. It's about knowing ourselves. We are learning about our boundaries. We are befriending ourselves by setting these boundaries. So this decision of who and when to share your pregnancy news with is actually really helping you develop so many of your parenting skills. So finally, we're going to talk just a bit about home Dopplers. So if you don't know, home Dopplers are these devices. You can buy them on Amazon. You can get them anywhere. People used to steal them from our office all of the time. So they're these little devices that you can put on your belly and get baby's heartbeat. They will detect, your heartbeat, baby's heartbeat. They are not specific to baby's heartbeat. And that's part of the problem. That if you are not skilled in using them, you can very easily pick up your own heartbeat. You would think like it's down in your belly. How are you getting your heartbeat? But there's big, huge blood vessels in your pelvis. And so you can very easily pick up your own heartbeat. So people do that all the time when they use it at home. Now, a fetal heartbeat is usually about 110 beats per minute to 160, though, for brief periods of time, they can go above that and below that. So usually the fetal heart rate is higher and your heart rate is lower, but in pregnancy, our heart rate does go up. And so a lot of people will either have a really difficult time finding the fetal heart rate, And so that will totally freak them out, or they're getting their own heart rate. So it's not as helpful as one may think. Now, once we got to about 23 weeks, once baby is viable, the Dopplers are no longer helpful or reassuring, okay? A lot of times the way that people use Dopplers is they will feel baby moving less, and then they'll put a Doppler on and say, oh, the heart is beating good. But once we get to viability, we look at more things than just, is the heart beating or not? And so we don't want a false sense of reassurance with home Dopplers. Okay? All right. When you're ready, I will see you in the next video.